This is Open Mind Alexander Technique. I'm Jess. Today we're talking about habits that come from guarding. This can come from several different places. The especially relevant one that I'm thinking of today comes from that just like 10 minutes ago I wrapped up a lesson with a student who had come in on lesson 1 fully self-disclosing that she had a pretty strong trauma history and that she thinks that she really carries that with her. And that's the only information that I know about it. I don't ask for any details or anything like that. So that's the extent of the story. And in her lesson today, she's had 16 lessons. She was making comments that were kind of self-deprecating and disparaging of herself, saying, yeah, I just process things slower. And I think it's because I've just always been so guarded that I'm not able to learn things faster. It just takes me a long time and it's frustrating. And I said, well, of course, like with this kind of work and you're learning to let go of patterns that you learned from guarding yourself. She's talked about this one in particular, shoulders forward, curled, and neck forward, right? This is, I'm small, please don't hurt me, I'm scared, right? This is such a primal protect myself, guard myself, keep myself safe position to be in, that for her to be able to come up out of that is difficult and hits some of those old triggers and those old ways of thinking about herself as being lesser because of it. The reason I want to talk about this with my channel here is because this is really not very rare. This comes up fairly frequently. As part of my first day intake sheet, my information sheet that I ask all of my students, I ask them, is there anything else that you would like me to know about you as far as habits or history or anything like that? And I just leave it totally open. And fairly often I will have students who, feel safe enough in a one-on-one setting, day one. I've met them 10 minutes prior to that to tell me, some personal history stuff. And I always feel very honored and flattered that they're ready to trust me with that right away. Not everyone does. Some of them will tell me a little bit later once they know me better, which of course totally makes sense. When we're talking about habits that come from guarding, it's really important to move slowly because you've just got more to move through. When habits start, especially protective habits that come from a very real need to keep yourself safe, where you did not have safety and your ability to control that setting, all you can control is yourself and make yourself smaller and protected, yeah, it's going to take longer because there's just more to work through. Every once in a while with Alexander Technique lessons, fairly rare, but it does happen, every once in a while, people will actually go into a flashback when they let go of a guarding habit that they didn't realize that they had been doing for a really long time, and they let go of that, and all of a sudden it hits an actual flashback, and they get very frightened and very dysregulated. They often start breathing really quickly. They might start sweating. I'll often see the color of their face or their hands change as their blood pressure and blood flow changes. So those are cues that we, at least in my training course where I trained to be an Alexander Technique teacher, I was taught to keep an eye on those things because you never know when that's going to happen with someone who hasn't told you their deepest secrets, because why would you? So those little cues of things like color changes, of sudden dysregulation, sudden shaking, expression changes on people's faces, those are things that I am trained to look for. And it's very helpful to be able to stop for a second and just ask, hey, I'm noticing this change in you. What's going on? Or do you want to talk about that at all? It's always important as an Alexander teacher to have it be totally fine. If you need to take a break and go walk down the hall to the water fountain, take a minute, sure, absolutely, that's fine. I'm always also very deliberate and careful to validate that when habits like that come up, and there's difficulty in the release of them, that it is not something that you have done wrong. You are not inferior for having had experiences that you responded to in the ways that you needed to at the time. And now Your power in this situation comes from being able to make a different choice and to notice that you do have support from internally and externally. So with the student today, one of the ways that this comes up fairly often, and she's at a point with this stuff where she laughs about it and there's a good vibe to the discussion. I often start her cues, her reminders for her directions from the bottom up, because I find that that gives people who especially have trauma and anxiety history a sense of groundedness and support and security first, and then we work upward from there. So I started by saying, so coming back to your directions, the floor's got you. And she just started laughing. She said, every time you say that to me, I keep wanting to go, no, it doesn't. You don't know that. Yes, it does. It's not going anywhere. Look, it's very stable. The floor's got you. Start there. Noticing your feet on the floor and noticing that the floor is not going anywhere. From there, that gives you the reassurance and the stability to be able to ask the knees to do just a little less, to be able to unlock and soften the knees a little bit. Unlocking in the legs then helps to find a better position for the torso, allowing lengthening, widening, that soft nestled connection all the way up the spine, and noticing the connection of the neck to the head to allow that support to be present. That you don't have to pull yourself into a correct position. Ease, which creates the side effect of a more helpful position, in this case, comes from security. So, what I would encourage either people who have this type of history or who work with other people who might have that type of history to think about: can we create security first? Can we remind ourselves or our students or clients, whoever you're working with, that the floor's got you? If you're seated, you can let the chair do its job, you can let the floor do its job. And it is okay if that feels like it's taking a long time, or if it feels ineffective at first. Because you come by your habits pretty honestly. And it totally makes sense that this is just going to need to take a little bit longer, and that is fine. There is no correct pace for nervous system change. Because all of those little steps that you can make along the way, every single one of them is progress, and it is important, and it's all valuable. So I encourage you to think about this in the context of providing and creating the chance to have security that then can create ease.